Good morning, everybody. Welcome to Half and Half. Um, Today, Scott and I were talking about embodiment and working with that theme in class, which you might think, don't you always work with that theme in class? Because, we sort of do, and we use that term a lot, but I'm not sure everybody knows exactly what that term is. I've had people ask me questions. What do you mean embodied experience or embodied awareness? Um, and I think in my life, I've heard that what I call embodiment, I've known as different things over the course of my training in movement. And I would say I first thought of it in the term grounded, feeling grounded. And I heard that a lot when I was a young dancer. And I was taught a lot to be more grounded and use my feet more and feel my pelvis more and feel my weight more and move in and out of the floor in ways that were natural to human bodies. And at some point, I started hearing the words "be in your body." We're not always in our body, or sometimes we leave our bodies. We want to use practices to get back in our body, as opposed to using a practice to leave our body. And I'll talk a little bit about that in a moment and what that means, because that also can be confusing. Um, and so that, I think, using that term, maybe I felt that more when I was studying yoga and thinking about those practices a little more. And the first chakra felt very resonant to that, like things that were taking care of your body and taking care of just your everyday physical needs, eating good food and making sure you exercise and you can have a place to live and get your bills paid and all those sorts of things. Anything that had to do with the physical, and that felt really resonant. And also that has to do with the pelvis and the feet, that area of the body. And now, we talk about embodiment. And another thing that I think comes up a lot is the word safety, and people feeling safe in their bodies or just feeling safe in a situation. And I think there's a lot of ways we could unpack what that means. And ways people negotiate safety. And there are ways that we negotiate safety with our external surroundings. And then there are also ways we negotiate safety by feeling safe in our bodies. And I think the idea of feeling grounded and feeling taken care of and feeling embodied has very much to do with that, like feeling in ourselves. So that's more what we're good at here, is teaching people to find that feeling a little more and to understand what are the things that we can do to feel kind of safer in our bodies when that's appropriate, when we need that. And all the other images, I think, also apply. So if one of those other images resonates with you a little more, I think that's a good way to think about it. So using movement to be in your body versus using movement to leave your body, or using movement in a way that's embodied versus doing movement in a different way. And so I think that image right there has to do with how we relate to sensation, which is very complicated. I'll just put that out there. And how we feel sensation, um, and how we respond to sensation and make choices. So I think sometimes we can push really hard and ignore what we feel and just sort of like go, well, I'm going to run a marathon and that has to happen. And I'm just going to do this training. And even though I'm sick today, or even though I feel like I'm going to throw up or whatever it is, I'm not saying that's always wrong. Like there's lots of ways to move. But then sometimes when we push too hard in that way, then suddenly we're sick the next day, right? And we can't train and we lose all momentum. I never would run a marathon, but if I did, this might happen to me. And you can apply it to anything. So I think that's one way of thinking of movement to leave your body, to not feel, to not pay attention. On the other side of that, sometimes we can get so neurotic about our sensation that we don't know how to move forward. This hurts my neck, or this hurts my back, or I don't know, I feel that in my abdominals. Should I feel it in my abdominals? And always backing off and never feeling like we can take risks. And that can also be a little like out of your body, like avoiding sensation can be a difficult thing. So I could maybe talk for a full hour on all of this, but those are just some ideas that a lot of when Scott and I teach, and all the instructors at Pilates on Harrison, a lot of times what we're asking you to do is just to feel things and to not decide whether it's right or wrong or good or bad, but to go in and notice it and then make some choices. Oh, okay, well, today I'm going to try this. I'm going to see if I can feel a little more abdominal muscle. That seems good. That seems like it's working. It seems like enough. Um, and then tomorrow I'm just going to like notice that sensation and keep going. And to not judge any of the choices necessarily, but to go in first and just observe the sensation, explore the sensation. And then the more you practice, the better you are at figuring out what the right choice is. You just start to know things better and know when something's too much and maybe know when something's not enough, and know when you can push forward. But the first step is really just starting to feel things and observe things, try things, and yeah, see how it goes. So that's my 5-minute intro. It wasn't an hour, it was just 5 minutes, but thank you for staying with me. But let's start to move a little bit. So we'll go on your back. And again, we can just start with that exact thing I was talking about. So I'm just going to breathe. My knees are bent. My feet are flat. And I'm feeling the weight of my body. And for me, that has to do with really noticing what's touching the floor and noticing what's tense. And the tense areas, to me, often feel like they're pulling up out of the floor. So if I have tension in my hips or my lower back, that tension feels like it's holding my bones up out of the floor. And so I often think, oh, okay, maybe I could relax that a little bit. And when I do that, things start to feel heavier. The floor is supporting my body more. And really getting in touch with that weight right there. That feels like step one to feeling more in my body, is that my body has weight to it. And then I often go to my breath. How's my breath moving? And not trying to force my breath to be any certain way, but just noticing how it's moving. And then after I've noticed it, observed it for a while, I might make some choices. I might think, no, I'd really prefer to have my breath move through my back a little more. Or I'm doing a lot of breathing in my belly and my chest feels stiff. What if I breathe through my chest more? But I also might just observe it the way it is and keep that attention. And then I could also think, which image of breathing helps me maintain my sense of weight? Put the two ideas together. And maybe those two things together feel more in my body. And then layer 3, we add some movement. So right leg floats up on my next inhale and floats down on my exhale. And I alternate that. Left leg, inhale and exhale. So I've got 3 ideas and I just kind of observe those ideas. How does my weight feel in the floor? How's my breath moving? And then very simple action. Leg up on the inhale Leg down on the exhale. We'll do this a few more times. And then after you've finished, evened yourself out, we'll take your hands behind your head, elbows a little lifted off the floor, and adding the mini crunch as our movement. So exhaling, head comes up, and then a full breath in and out with the head lifted. And the inhale takes you back down. And then we start that cycle. Exhale to bring the head up. Pause for a full cycle. Inhale, exhale. And then head comes back down. So I've still got those three things. I have weight, I have breath, and I have movement. And I'm just observing the interaction there. And for me, I often consider my weight in this exercise in my pelvis. That's an easy place for me to think about that image. Is my pelvis staying pretty heavy? Or does it feel like it's pulling up out of the floor? One more time. I'm going to stay up this time. Head stays up, arms reach forward. We take this into the 100. Legs come up, little pumps. 5 pumps to inhale, 5 to exhale. And sometimes, as you're observing your breath, your movement, your weight, lots of stuff starts to happen. Maybe you start to feel your abdominals come on naturally. You didn't decide to turn them on, they just started working. Maybe you noticed your neck is going just nuts and your abs aren't working that much. So you might make a choice there. Take a hand behind your head. Does that help? Two more. And then head down and feet down. We'll take a moment here. Settle everything in again. Observe a little bit. And then, however you'd like, come up to sitting, find a way up to sitting. So take your legs straight out in front of you. Use your hands and get yourself up on your sits bones. And if you can do that with straight legs, like this is the experiment, right? Like, okay, my legs are straight. Can I get up on top of my sits bones? Does that feel pretty doable with my hands there, or totally impossible? And if it feels more in the totally impossible scale, then take your legs out a little bit, bend your knees, see if it's more possible here. And then third version, still impossible here. get up on a chair or get up on a yoga block. Give yourself a little height. You can do this same spinal exercise, whether you're sitting on the floor or sitting up in a chair or sitting up on top of something. So legs can be apart. Legs are apart for everybody, actually, on the floor. And then legs either straight or bent. And then if you're in a chair, just feet on the floor. And then seeing if you can feel, okay, you were on your back for a while, your head and your ribs and your pelvis were all in one line. Can you get that sensation while you're sitting up? Can you get a little sense of support from your front body, from your abdominals? Can you get a sense of weight in your sits bones? Arms come forward. Take a breath in. Exhale, rolling forward through your spine. Inhale, rolling up through your spine. And we take that a few times. And as I come up, I start from the feeling of sits bones. I start from a sense of weight in my pelvis and let the spine float up above that weight. As I exhale, I just see how much I can exhale. Not like pushing the air out necessarily, but if I just keep releasing in the ribs and the chest and the back, maybe a little more exhale happens, which makes a little more room for inhale as I roll up. 2 more. And then relax your arms. Maybe do a little sort of drop back a little bit, whether you're in a chair or on the floor, you can kind of drop back. I'm going to turn to face you. I think you might be able to see a little better if I do. And so wherever you're at, we're now going to do hands behind your head. Still a little bit of lift. And then a little bit of rotation. So you're going to inhale and rotate to one side. And exhale and come back to center. And then taking that to the other side, inhaling. And exhale back to center. Sit bones stay heavy. So as I go to the left, my right sits bone wants to come up very often. I'm going to think of a little weight through there. And back to center. And then as I go to the right, I'm going to think weight in the left sits bone. Pelvis, half. And I'm inhaling to rotate. And exhaling to center. As my pelvis has its weight, it actually allows my spine to feel like it floats up a little more. One more time. And then resting your arms down. From here, we're going to go to one side. So I'm going to go onto my right side. Maybe you can do the same thing, and then my cues might make more sense. So I'm going to be lying on my right side. My right foot, actually both feet, are going to be forward towards the front edge of the mat, and the pelvis towards the back edge of the mat. And then my left hand, my top hand, on the floor in front of me. So I'm going to do that same weight sort of observation, awareness exercise again, because lying on your side is unusual. We don't do it that often. So feeling weight lying on your side is a little different. So I feel head, kind of rib cage, armpit-ish area, and then my pelvis, my pelvic bone a lot, like my hip bone a lot. For some people, it's really tender there, so you can always use a blanket underneath there. But also I find bending both knees a little bit often takes some pressure off of that for people. So that might be something to notice. And then I'm just really feeling that right side of my body, the outside of my right foot, my thigh. My thigh wants to really pull up, if I'm being honest, so I have to like remind myself to release it again. And then my rib cage. And then we very often talk about finding a little oblique work here, finding the underneath feeling of the abdominals around the waist and thinking of the ribs drawing together in the front. So I have some weight in some areas, but then I also have a little bit of engagement and lift in the abdominals there. I'm going to float my left leg slightly up and then start a little forward and back with the leg. Inhaling to go forward, exhaling to go back, and inhaling forward and exhaling back. And I think this one's so cool because the weight really changes. As my leg goes more forward, I feel different parts of me taking more weight. My hand pushes down as my leg gets farther forward. I can feel that. My leg wants to get a little lighter when my leg goes back. And it doesn't have to be static. It doesn't always have to be exactly the same. But it is interesting to think about what feels like tension and what feels like weight. So what's the difference between being grounded through your right side or being overly tense through your right side as you move the leg back and forth? Two more. And then both legs come together. Now, I'm going to really use that sense of weight. I'm going to push a little more through my left hand, my top hand. I'm going to try to keep the upper body really heavy and grounded, ribs drawing up, and then start to lift both feet off the floor and then come back down. And I say start to lift because I did this exercise for at least a year and my legs would not come off the floor. So yours might come off the floor right away, but you might also be like me where you just think about bringing the legs up. They don't come very high. So I still got a lot of work. Like I did it for a year without my legs coming off the floor, and then one day they did, and that was pleasant. But I always got a lot of work, even if I was just thinking of getting them off or just getting them like into a tiny little hover. So we're going up and down a few times. My neck started to tense up and I just let my head be a little heavier. I found my nice grounded push through my left hand. And two more. And then bend your knees. For some reason, this is always my favorite part because maybe I'm a dancer, but just push into your left hand and come up to sitting. It feels like kind of a lovely movement. So maybe you like that movement too. And then switch over to the other side. And then take a moment here. What's it like to be on your left side? I've got scoliosis. My left side and my right side feel very different. So depending on your body, you might have some imbalances too. It's kind of interesting to notice, oh, well, this hip actually feels like it pushes down a little more. This rib cage feels a little more open. Or you might notice a lot of symmetry. It's kind of cool to know about yourself too. And I'm pressing a little bit through my right hand in the floor. Nice grounded press as my top leg comes up. We start forward and back. Inhale on the forward, exhale on the back. And again, you might have your bottom knee bent. Maybe that feels a little better on your hip. If it bothers your underneath hip, you can do that. Ribs are drawing together just a little bit in the front, especially on the exhale. Two more. And then legs together. So as the feet are going to come up together, I'm going to have to push a little more through my right hand, my top hand, and really think of my weight staying heavy through my rib cage. It's very common for the ribs to want to pull up on this one, out of the mat. So I just consider that groundedness a little bit more when I do it. Now we'll do a few more. Two more. And then bend your knees. And then we get to do this very supple transition where you press through your hand and you come up to sitting. Okay, so we're going to go into a seated position again, but this time you're going to lean slightly back. So, your sits bones, these kind of butt bones, these pointy bones here, you want to be on the back edge of that. You want to be behind them a little bit. My nephew is very thin, and my sister often calls him pointy because he has very bony. So maybe you have really bony, pointy sits bones. You want to be behind the pointy part. So heels together, toes apart, knees a little bit open. So I'm back in that behind my pointy area. And then I'm going to use my exhale to just feel a little bit of support through the ribs, through the belly, but easy kind of head, neck, chest. I'm going to hold on behind my thighs. And I'm going to keep my weight down in my pelvis. Really pay attention to that. As my feet come off the floor, the first thing that wants to happen is I want to lift up on my sits bones. I lose my weight. So I'm going to try to stay back there. And then I'm going to see what happens as my legs start to extend, however straight seems about right to keep that sense of weight. And then bending the knees down. And back to sitting. Let's go through the whole process again because now you know what I'm asking you to do. So get behind the sits bones. Find a little bit of abdominal support. And then feel the slow transition, taking the feet off but not popping up out of your pelvis. And then same thing, I'm going to exhale as the legs reach up, trying to keep a sense of weight in the pelvis. Not collapse, but grounded. If you want to try it without the arms, it's a little different challenge. They're both pretty challenging. I don't know that one's more or less, but they're different. And one more. And then relax. Scott's going to take us into the next half hour. Be fun to see what he does. I'm going to remove my mat. soft, be ceremonial.
Hi, everybody. And maybe we're seeing each other again. Some of us were together at 7:30 for the 2020 class. And so picking up with this idea of embodiment, and I'm going to work a little bit with what we may call stretching, but I'm always really hesitant to use that word because very often stretching is something that's really done very disembodied. I know some people may not agree with that, but as having taught yoga for a long time, what I watched a lot of people do is they would stretch their body. It's like their mind was over here and their body was over here. Doesn't mean that you should never stretch, but just that we want to take a look at the approach and how we're going to do so. So let's begin with our feet wide apart. And then turning your left foot in and your right foot out. And let's make some movement. Exhale, ankle, hip, and knee bend. And then you inhale, straightening. I think the hardest part for many people, I know for myself as I was starting to explore embodiment, was that I was looking for something really dramatic to happen. It's really quite ordinary. It's profound in its ordinariness. Is to simply feel your body just as it is. So next time, knee in the bent position, pausing there. And then bring your hands into prayer position. Now, what we're doing right here is working muscles in pretty much the least efficient, least effective way possible. I know that may sound like a bummer, but holding a position isometric isn't very effective for strengthening, truth be told. But what it's very effective for is sensations. Maybe you're already starting to feel maybe a little bit of a tug in your hip, maybe a little bit of a burn in your thigh. Now, as tempting as it can be to sort of sense it from a distance, as best you can, drop into the sensation and inhabit the sensation. We'll take a few more breaths here. This is the essence of embodiment. Inhale, coming up and turning back toward the front. As my dear meditation teacher Mingyur Rinpoche says, these practices are simple, but not always easy. Second side, turn your right foot in and your left foot out. Exhale, bending. Inhale, straightening. Up and down like that. Then the next time that your knee in the bent position, pausing there. Bring your hands into prayer position. And we'll wait here for a bit. Kind of like calling a cat. Just because you call them doesn't mean they're going to show up. And so we're going to hold here for a bit. And more than likely, given enough time, the cat walks into the room. Or the sensations in your body start to percolate. Now, interestingly, in my body, what I felt on the first side is really different than what I feel on this side. And even though there's a temptation to question that, judge it, just drop into my body and feel the sensations, whatever they may be, just as they are. Now with the next inhale, coming up, turning back to the front, and then stepping your feet together. Now all this talk of embodiment doesn't preclude doing a little bit of work to help improve your alignment. So to that end, take your pelvic crest very lightly, literally a small fraction of an inch. Lift your pelvic crest up to help lift your chest, and hold your head up high. And keeping that little bit of lift in the front of your pelvis, shoulders a little bit up, little bit back, little bit down. Now, the ever-present challenge in this sort of alignment work is that we are aligning the body, This thing up here is controlling that thing down there. The best you can, relax your forehead. Metaphor for calming your thinking, thought process, mind. And descend awareness deep down into your belly. We'll take a few moments to explore the practice of embodiment. All right, in a few moments, we're going to wade into the difficulty of stretching. And I say the difficulty because it's really interesting to create that dissociation. So what we're going to do is find the moment a stretch arises. To do so, step your feet wide apart. Turn your left foot in and your right foot out. With the exhale, bending your knee, just like we did before. Pause there. With the next exhale, tip your hips. Elbow to knee, hand on your hip. We'll take a few breaths here. Now transitioning from elbow to knee to hand on your shin. And there's a darn good chance you're going to feel a stretch somewhere in your front leg as you slowly straighten that front knee. And going only so far as you feel a little something. A little bit of a tug, a little bit of a stretch. That's about it for me right there. And like you're a connoisseur of sensation, drop into it, savor it. Most importantly, feel it. And then inhale, coming up, back to the front. Second side, turn your right foot in, left foot out. Exhale, bending. Pausing there. Next exhale, tipping your hips. Elbow to knee, hand on your hip. Pausing there. It is possible to push deeper into a stretch and remain embodied, but increasingly difficult to do so. So because embodiment is so calming for the mind, especially during these stressful times, we're going to go right to the liminal edge of stretch. From elbow to knee to hand on your shin. And with a quality of curiosity or inquiry, slowly straightening that front knee. Now once again, my experience left side, right side is apples and oranges. There I start to feel a little bit of a stretch. I'm feeling it on this side of my hamstring. And I'm just going to pause there. I'm not trying to change that experience. Not trying to highlight the good stuff and negate the bad stuff. I'm staying with it just as it is. Then as if your mind were in that sensation, not perceiving it from a distance, but directly inhabiting it. Inhale, coming up, turning back to the front, and stepping your feet together. So now we're going to make our way to the floor. Earlier session, I did kind of a fake out on this one. Today, we'll actually make it to the floor. Arms to the side, exhale up. And then arms to the side, inhale down. Exhale, gorilla. Inhale, dog pose. We'll take a few moments here in dog pose. No need to focus on anything special or particular. Just simply letting your head hang. Feeling whatever you feel, whether it's your hands on the floor or feet on the floor. Maybe something else, maybe something different. And then with the next exhale, coming down. And then making your way onto your back. So on your back, we're going to continue with that exploration of rather than pushing as hard as you can into a stretch until you can't go any further, which tends to be our cultural paradigm, to come just to the point where stretch arises. So we're going to do that with the hands and the wrists. So start by interlacing your hands. And then hands interlaced, take your palms up toward the ceiling. And in doing so, straightening your elbows only to the point where you start to feel a little bit of a tug, which means for almost all of us, the elbows don't straighten all the way. It'll take a few moments here, feeling whatever you feel. I'm feeling something in my left forearm. Interestingly, I don't feel the same thing in the right. And then, of course, I can feel my fingers contacting each other. So now in that same vein, taking your arms toward the wall that's back behind you. Now, right about here, people's lower ribs tend to pop up. That's because their shoulders are kind of stiff. So lightly engaging your belly to keep your ribs knit. And then taking your arms toward that wall behind you, just to the point you feel something, anything. And for me, it's right about here. Now, I could probably push my arms to the floor, but that would be my mind some distance from my body, imperialistically executing a command upon my body. So in the interest of integration, body-mind, exhale, sweeping your arms up. And then releasing your arms down. So now we're going to bring the same approach in articulating the spine and building on something I talked about on Thursday, lengthening the quadriceps. So to begin, take your lower back and press your lower back down onto the floor. To keep your lower back pressing down as you lift your pelvis up. And keeping that posterior tilt in your pelvis, tilt in the pelvis, or tilt in the pelvis, your choice. Now, in keeping that posterior tilt, when the hips come up to a certain height, more than likely sensation starts to reveal itself. And some people may be feeling this in the hamstrings. Some people may be feeling the tone of the belly muscles working. Other people may be reporting the stretch in the quadriceps. We'll take a few breaths here, feeling whatever it is that you feel. And then slowly, slowly coming down. And we'll take a few breaths here. So that really is the essence of embodiment, is simply feeling your body, not as a distant experience, but as an imminent experience. So now inviting awareness to your feet. No need to do anything with or to your feet. Simply watching what happens as you press your lower back into the floor. Watching what happens as you lift your pelvis. And maintaining that posterior pelvic tilt, watching what happens in your feet as you lift up. Now, I can't knowingly speak of the experience of quadrupeds like dogs and cats, how they experience their bodies. But it sure doesn't look like there's much of a mind-body split. It looks pretty unified, especially the wild animals. But humans, I sometimes wonder if it's that our head is just so far distant from much of our body. And when we're in our head and not in our body, people tend to feel anxious and often report more pain in their body. So especially if you've had a lot of pain in your body, inviting awareness down into your body, whatever sensations you're feeling right here, right now. As paradoxically a remedy for the experience of pain. Then maintaining that posterior pelvic tilt as you slowly, slowly lower your pelvis down. And then rolling up to sitting. You worked with this with Colette. And then all the way up onto your feet. And letting your head hang. For most of us, excuse me, it's a pretty rich with sensation right here. In my body, I'm feeling a fair bit of blood in my head. I'm feeling a stretch in the backs of my legs and my hamstrings. We'll take a few moments here quietly for you to feel what you feel. And with the exhale, stretch the crown of your head forward. Inhale, folding. Exhale all the way up. Inhale, arms down. Now a medium wide stride, not as wide as what we often do. Turn your left foot in and your right foot out. Turn your right foot in a little bit more so that you comfortably face toward the side. Now bending that front knee, your right knee. And then keeping it bent, fold from your hips and bring your torso to about horizontal. Now, many people report a little bit of a tug in the back calf. If that's your experience, aware of that experience. And now the front leg, slowly straightening that knee and watching what, if any, sensations emerge. Right about there, I feel something in my hip. And I start to feel a little bit of a stretch. I'm going to pause right there, right at the inflection point. And steady breathing. What if your mind wasn't in your head? What if your mind was in that sensation, those feelings? Embodied mind, as you inhale up and turn back toward the front. There are a number of labs around the world exploring consciousness. Very prominent one here at UW-Madison. So far as I know, they've not figured out where is consciousness, where is the I. Could be in your big toe or your forehead. We don't really know. Let's take a look at the other side. Right foot turns in, left foot turns out, right foot turns in a little bit more. This side maybe is the same, but more than likely it's different. Bending that front knee a bit. Then folding from your hips, pelvis rotates forward, spine, neck, head, come along for the ride. And then slowly, slowly straightening that front knee. Already I can feel this side's much different than the other side. And then right about there, I'm starting to feel a tug in some specific fibers in my hamstring, so I'm going to pause there. I'm not trying to breathe into the sensation or alter it in any way. I'm dropping into it. A few more breaths here. Inhale, coming up. Turning back to the front, stepping your feet together. So why embodiment? When there's a lot of pain in the body, we tend to leave the body. Understandable. In my experience, it tends to fan the flames of the pain. So this is not true every time, all the time. But sometimes dropping into discomfort in the body can help ease discomfort in the body, especially during these stressful, unprecedented times. I think anxiety, depression, almost all of us are living with it to some extent. It can be so easy to detach from the body, spend more time online, surfing this, surfing that. Return to your body, drop down into your belly, feel your feet on the floor to help calm your mind. And to transition to the floor, using a sun salutation to do so. Exhale, arms to the side up. Inhale, folding. Exhale, gorilla. Inhale, dog. And we'll take a few breaths here. And then coming down. So something you explored, at least a similar movement. Legs out in front. So lifting up a little bit. If you have long arms, this is easier. And then lowering yourself down onto your two sitting bones. Now already I'm feeling a little bit of a stretch in my hamstrings. Then folding forward to slightly intensify that feeling. Hands maybe come to your knees, maybe to your shins. And steady breathing here. So using the position to create sensation. Aware of the emergent sensations and letting that be the meditation. We'll take a few more breaths here. And then exhale, coming up. So now guided relaxation. So reclining back, without stretching your legs like I am right now, proves uncomfortable for your lower back. Put something under your head, pillow, rolled up blanket, towel. And if it's still uncomfortable for your lower back, then place a second blanket, towel, pillow under your knees. Now, whatever position that you're working with, whether head supported and perhaps knees supported, then rest your arms wherever it's comfortable. Now, this is where it gets a little more elusive. But sometimes leaving the body feels relaxed. Not dissimilar to the relaxation you may feel by dropping into your body. So with all the benefits of embodiment, helps some people reduce pain, helps almost everybody reduce anxiety and depression. So how can you work with embodiment in this relaxation right here? Well, start by feeling the surface that supports you. Whether it's a floor or a sofa, your bed, or a recliner. To scan your body and feel the points of contact. So for example, on my body, I'm feeling my forearms contacting, my heels, backs of the hands, shoulders, hips. Nothing needs to be done with those experiences, including relaxing. That the vast majority of the benefit is to simply feel the contact. Nothing more needed. Bodies are a rich, nearly limitless experience. So in addition to the points of contact, inviting awareness to the contact of your clothes on your skin. Some of you know this facility where we are filming, the Blue Mounds Movement Lab. And maybe you remember hot summer days. It's not air conditioned. And so right now we have a number of fans, and I can feel the air moving across my skin. And simply feeling that contact, that flow, is another invitation to embody. So whatever sensations you may or may not be feeling in your body, we'll take the next few moments quietly. An open invitation to feel your body as a pathway to inhabit your body. All right. If you've closed your eyes, now opening your eyes. And then gently making your way from reclining up to sitting. If you have any comments or questions, feel free to type them into the chat box. So thank you all for joining us on our half and half. This is our free class we offer every week. And we know that a lot of people out there are on furlough, maybe have lost their jobs. We want to make sure that there's content available for anybody, for everybody, because it's our ardent belief that these practices of body and mind can help us navigate these turbulent, challenging times. So, any questions? It looks like the chat box is empty. I left a couple minutes for those questions that are not here. Happy 4th of July, and hopefully our paths will cross again really soon. Thanks for joining us.